6 prominent medical groups, including the American Academy of Pediatrics and the American College of Physicians, have filed a lawsuit against Department of Health and Human Services HHS Secretary Robert F. Kennedy Jr. over recent changes to COVID-19 vaccine policy. The groups claim that Kennedy's actions are arbitrary and capricious and undermine the science behind vaccine recommendations. Allegations against Kennedy. The lawsuit alleges that Kennedy unilaterally announced sweeping changes to U.S. vaccine policy, including removing the Centers for Disease Control and Prevention (CDC) COVID-19 recommendation for healthy children and pregnant women. The plaintiffs argue that these decisions were made without input from federal vaccine advisory groups and are founded in fear rather than evidence. Concerns about vaccine safety and efficacy. The medical groups are concerned that Kennedy's actions will mislead the public and desensitize them to anti-vaccine rhetoric. They also criticize Kennedy's decision to remove 17 members of the CDC's Advisory Committee on Immunization Practices (ACIP) and replace them with 8 new members, including several anti-vaccine allies. Impact on patients and physicians. The lawsuit highlights the potential negative impact on patients and physicians, particularly a pregnant doctor who has been barred from getting a COVID-19 booster due to the new recommendations. The doctor claims she is at high risk for exposure to infectious disease due to her job as a hospital-based physician. Request for injunction. The lawsuit asks for preliminary and permanent injunctions to halt Kennedy's COVID vaccine recommendations and declare the changes unlawful. The medical groups argue that Kennedy's actions pose an existential threat to vaccination in America and will unleash a wave of preventable harm on the nation's children.